It is 7 p.m. Good evening, everyone, and welcome to Shine the Light on Sickle Cell. I am Mary McKinley Reed, president of the Toledo chapter of Top Ladies of Distinction Incorporated. The amazing collaborative teams reached into the community for some effective persons to deliver to you this evening. This information is on point and it's necessary to share. You will be wowed from the professionals to the authentic personal experience and much, much more. You, my sister, my brother, my friend, are here by design and not a coincidence. Please know that we are elated to have you in our presence. All are welcome. And now we will hear the purpose of the program. This information will be brought to you by a very busy young lady in the Toledo community. She serves as first chair of NBPW, second chair of the Top Ladies of Distinction, but she is the proud governor of NPBW. And I am happy to call her my friend. I would like to present to you none other than Denise Black-Poon.
Thank you, President Lady Mary McKinley Reed. I want to thank everyone for bringing themselves and their friends to this sickle cell program. It is truly an evening that I'm glad to share with you and hope that each of you will learn great information that we can share with others. This presentation is public, and we hope that everyone can listen to some of the important points that will be coming up. As we start the program today, we would like everyone to feel free to use the chat box and ask questions, and hope that if you have any questions, you can send it to Linda Collins or Alexi Collins, who will be monitoring the chat box. Please mute your phones when presenters are speaking, and it will eliminate the background noises and interruptions and people walking through the background. Please take your notes and pass the information on about sickle cell to your friends and other families in the community. The purpose of this presentation today, we would like you to know that health is a very important part of our collaborative organization. September is Sickle Cell Awareness Month, and what a better way to take time out with each of you to share the health issues around sickle cell. Our collaborating members are wearing maroon or red in honor of Sickle Cell Month. These organizations have collaborated to help you find ways that you can learn about these health issues and the things that they face and challenge each day with each person. During this time of COVID, we wanted to remind everybody that it brings awareness to each one of us and touch each one of our hearts, as we would like to find out some of the things that sickle cell awareness members go through. So please think about the person that might be. Are you living with sickle cell? Are you a person living that has a trait? Are you an advocate or others? No matter what it is, the members of the collaboration team share a common need and want to help others to be of service in our community. We consist of women from many organizations that work hard every day to bring awareness to our communities. Our collaborating organizations are the Adult and Youth Clubs of the National Association of Negro Business and Professional Women's Club, Toledo Club, and the Maumee Bay Club. Top Ladies of Distinction Toledo Chapter, the National Sorority of Phi Delta Kappa Sorority Incorporated Beta Gamma Chapter, Pathways for Success Leadership Academy, Zeta Phi Beta Sorority Incorporated Zeta Xi Zeta Chapter, and of course, the Ohio Association of Beauticians and the Sickle Cell Project with Ms. LaCharde Scott. We want to thank you for joining us. Next on our program, we will have Brenda Halsey, who will be introduced our very special guest for you today. Thank you.
Good
Brenda?
evening, and I have the pleasure of introducing our first speaker. She is such a busy young person. LaSharde Scott is the project director and newborn screening coordinator for the Region of 3 Neighborhood Health Association Sickle Cell Project of Northwest Ohio. She has a bachelor's degree in social work and communications. Her master's is in mental health and chemical dependency, nonprofit management, and also grant writing. She is currently enrolled in the University of Kentucky working on her doctorate of social work program focusing on administration and leadership. And she is such a leader. She's an amazing mom of 3 boys and a bonus mom. She has a stepson. She's passionate for those that are affected with sickle cell. And we're glad to have her as a collaborative person in our community that is doing so much in the community. She also is a part of, she's a certified community health worker for the SCDAA Michigan Charter in Detroit, Michigan. So Michigan also, she's busy there as well. And under the direction of Dr. Wanda Witten Sherney, who has taught her and helped her with the author of the book, What Dr. Sherney Taught Me. I would like to have an autographed copy of that book. Also, on June 19th in 2019, World Sickle Cell Day, LaSharde was given a proclamation from the mayor's office of our city of Toledo on the combat to sickle cell awareness. In October, she was presented a research on the assessing post-traumatic stress disorder. She is busy empowering, and we are so happy to have her to represent our city, also Michigan, because she is busy getting awareness out. I introduce to you now LaSharde Scott.
Thank you, Dr. Brenda. So today you guys are in for a treat. We have an amazing panel. Each one of these individuals hold a special place in my heart. I'm not going to read their bios. I'm just going to introduce them, tell you a little bit, and then I'm going to let them tell you who they are, because me saying it is just not as powerful. So starting off, Annie J. Ross Womack is my mentor. I love her dearly. She is over the Ohio Sickle Cell Affected Families for all 88 counties of Ohio. So when we talk about busy, Miss Annie has me beat. So Annie, can you unmute yourself and tell us a little bit about you?
Sure. Thank you, LaSharde. I am Annie J. Ross Womack, the Executive Director for the Ohio Sickle Cell and Health Association. Under the Department of Health, I serve as the statewide Family Support Initiative Coordinator for all 88 counties in Ohio. We provide education, advocacy, and outreach for families and those living with sickle cell disease, sickle cell trait, or other hemoglobin blood disorders. For the national level, I serve as the state chapter of the Sickle Cell Disease Association of America, where we provide all types of services to people living with sickle cell disease, outreach education to pharmacies. We provide legislation support to advocate on the Hill, and we also seek funding. So we write grants, we provide outreach and education advocacy for all those who are affected. In the regional area, I serve as the regional coordinator along with my 5 states, which are Michigan, Indiana, Illinois, Missouri, Kentucky, and then we've added 3, so Minnesota, North and South Dakota. And so it's 8 of us in total. And so we work well together.
And I also partner with all of my bordering 5 states to make sure that all the children that cross the borders, that live in one area and work and play in other areas, also need the services that they get. So that's a little bit about what I do.
I'm sorry. Can you guys hear me now? Okay, so next is my mentee, Chelsea Parker. Would you unmute yourself? I'm getting her to come out her comfort zone, so this is good for her.
Hi, everyone. My name is Chelsea Parker. I am a sickle cell warrior. I have sickle cell SC. I am from Albion, Michigan, but I currently live in Ypsilanti. I am a first generation graduate. I just got my master's in social work, working in IP, which is pretty much mental health, and working with substance abuse. Right now, I'm just really willing to be able to bring awareness to sickle cell, and I'm happy to be here, and welcome everyone.
And then we have Clifton, who is a college friend. So Clifton, can you go ahead and introduce yourself?
Good evening, everyone. My name is Clifton Kirkbrand, graduate of Eastern University, where I received a degree in electronic media film studies. Currently, I am a freelance writer as well as reporter, and I too am a sickle cell warrior, 35 years old, and I'm a father. So I'm so glad to be here, and thank you for this opportunity.
And then last but certainly not least, my favorite hematologist, Dr. Crawford Strunk. I work with him directly with the Sickle Cell Project. So go ahead and introduce yourself.
Oh, I'm just trying to get organized. Okay. I'm Dr. Strunk. I'm the director of the ProMedica Pediatric and Adult Sickle Cell Center here in Toledo. I am actually trained in pediatric hematology and oncology, and really saw a need, well, since I've been here really, which is now 17 years, but see a need for our adult sickle cell warriors for, they just didn't, I felt like they didn't get the care they needed. And so we committed some time, effort, and energy, and we have now a thriving, I think, clinic for both our pediatric patients and our adult patients here in ProMedica. So I'm pretty excited about that.
Well, thank you, Dr. Strunk. And you ladies can go ahead and start asking us whatever questions you may have.
First, could you describe what sickle cell is and how it affects the body? That would be something that maybe someone would want to know.
Sure.
You want a medical? There you go, Dr. Strunk.
Oh, okay. All right. So let me see here. So I got to use my hands because I'm a visual sort of person. But basically, sickle cell is the most common genetic disorder there is in the world. In the U.S., it's about 100,000 people living with sickle cell disease here in the U.S. And roughly, millions more around the world. It's a change in the hemoglobin that is a genetic change that causes the sickle hemoglobin, when it's not carrying oxygen, to change the hemoglobin shape and form long strands, or what we call polymers, that alter the shape of the sickle cell from a nice discoid sort of donut without the hole entirely cut out of, shape into a sickled shape or crescent shape. And that can reverse itself on and off over time, or the cell could just flat out burst causing inflammation and activation of your white cells, your platelets, and generally causing a low hemoglobin, as well as blockage of blood flow beyond that aggregation of activated white cells and platelets. And that's what leads to a VOC. There can be acute complications, but there's also a lot of chronic complications. So you got to think, well, anything that blood flows to is going to give you potentially problems, not only in the acute part of it, but also the long-term part of it. And we know that sickle cell disease is really a disease not just of acute complications, but chronic organ damage. And that's what, unfortunately, we've not been able to help prevent using even some of the newer medicines that are out there. And so that's about as short of a of a description medically as to what's going on with sickle cell. There's all sorts of other issues that go along with it. We know that the disease itself is also a challenge as far as mental health goes: depression, anxiety, stress, stigma. All those sorts of things are also part of having this disorder, far more probably than any other chronic medical illness that we know about. So
There are about over 100,000 people in the United States who actually have sickle cell. Why are they either sometimes tired or go through a lot of pain? What makes this happen?
Yeah. So part of the reason why they're anemic is just the basic physiology of the disorder, right? Because as those sickled red cells are not able to function anymore, they either burst or they're taken out of circulation by themselves. And so it automatically causes a drop in hemoglobin. And that can lead to often fatigue in patients. They want to try to be active during the day. Kids have to go to school, adults need to go to work. There's a lot of fatigue involved there. The other part of that too is so the anemia is part of the reason why they're fatigued. Sorry, I forgot the rest of your question. I'm sorry.
Why about the pain and?
Oh, yeah. So part of the reason why. So it's interesting because pain has been one of those things, without going into the, miles and miles and reams of studies that have been done over the last several years. Sickle cell disease is a disease of pain, primarily because of that blockage of blood flow. And unfortunately, not only does it become sort of a chronic pain, it becomes, it sort of almost resets your nervous system so that you're almost always in pain. And there's often not a lot of medicines that we can do to help, or use actually to help treat that. And often what's more important is actually working towards good disease modifying therapy right at the beginning.
Is this a test that shows up automatically, or is it something you have to ask for?
So every state in the US, as well as the District of Columbia and Puerto Rico, do mandatory universal newborn screening for all babies for sickle cell disease. And so prior to 2006, it was state to state dependent. Most states had it, but there were a certain few that had to add it. And if you look at the history, New York was one of the first in 1975, but over time, like I said, by 2006, every state had added it. And so we know who they all are. The problem is that there is no national registry for our sickle cell patients. So unlike CF and unlike hemophilia, where they have these registers of people where, we know who they are, we know how many there are, we really don't even have a grasp of how many sickle cell patients there are. That 100,000 number comes from a study that a hematologist did looking at epidemiologic data and looking at birth rates and death rates rather than necessarily even sort of saying, okay, we know how many, they would go by what they got in their newborn screening for every state, estimate what the average, lifespan was, and determine sort of where they were on that curve to figure out what the actual number of patients are. So it's challenging because once patients leave childhood, where most of kids get their care in these very well thought out academic centers, typically, or well-funded programs, it's often left to, the local hematologist or the local hematologist oncologist actually to go about caring for them. And so there's not necessarily that level of support for that group of patients.
Okay, so we kind of want to get the perspective of our warriors. So do you guys want to share your perspective, like your story? Maybe Chelsea, you should start. Tell them about your recent experience.
Yeah, so I would say just growing up, when I was younger, I feel like just having SC is definitely different from SS, but I noticed that when I was younger, like we all had like pneumonia, and it was just something that happened and we didn't understand it. But when I was younger, I used to be always in and out of the hospital, dealing with those chronic pains. And recently I had what we call episode or a crisis. And it's just something that's unexplainable that I feel like I wish there was like something that could really get rid of it immediately. But most of the time I can, but sometimes it lasts or it lingers. And so I feel like that is something that has been a barrier for me when it comes to like things that I feel like depression or just like feeling down about it, because I feel like there's nothing that really has helped me cope with it when I do have it. So it's just been a lot of things that comes behind having sickle cell, honestly.
Clifton, Chelsea was sharing her experience with sickle cell. Could you just shine a light on some of the things you may have experienced, as much as you kind of want to tell?
Not a problem. I would have to agree with Chelsea. There is really no way to explain the level of pain that we face. I can only tell you, imagine getting, at times, right? Imagine getting hit by a Mack truck or a semi truck and you still live. It there's no timing, there's no, my father had epilepsy. And so sometimes he would be able to tell that he was getting ready to have a seizure. With us, there is no onset of anything to forewarn us that we're getting ready to have a crisis. It just happens. And so we learn to live with doing the most while we can, because we know that at some point in time, we may have to sit down or take a day off from whatever it is that we need to do because of crises. How as a child, the hospital was my second home. There was home, and then there was the hospital. And so, as you grow, you learn to cope with life, and you learn how to, as the phrase goes, now live your best life for what you've been given. And that's, I think, the number one thing that all of us with sickle cell live with, is trying to live the best life that we can, despite having this illness. I hope I answered that.
Okay.
Let me keep going.
No, I didn't know who was running the chat. There's questions in the chat.
Okay,
so-
there is some, I didn't want to interrupt. So yes, there are a couple of questions in the chat. If someone has the trait, what is the chances that their offspring will have the trait or even get sickle cell?
Can I take that one, Dr. Shrunk?
Sure, go for it,
He likes to
Annie.
talk.
I know I do
Dr.
like
C,
to talk,
Dr.
so
C.
I'm gonna let Annie have.
We've been on a lot of these panels and sometimes I don't get to talk. So, okay, so if the one person has the sickle cell trait and the mate does not have sickle cell trait, there's a 1 in 4 chance that the person may have sickle cell trait. But if the person has sickle cell trait, and that's with every pregnancy, it's not you line up 4 kids and then you say, oh, this one doesn't have it, this one doesn't have it, this doesn't have it, ooh, this one's going to have it, because that's not true. So it takes two traits, or a sickle cell trait and another hemoglobin disorder, to couple together to have a sickle cell disease or any other variation of a hemoglobinopathy. So, and in every pregnancy, depending on if there's 2 people with the trait, there's a 1 in 4 chance for sickle cell disease. There's a 50% chance that the child will have trait, and there's a 1 in 4 chance that the child will get both normal hemoglobin and not have the trait. So it's all in who you have your child with, and if that person has healthy hemoglobin. It doesn't have to be sickle hemoglobin. It can be any other hemoglobin disorder, because you can have sickle beta thalassemia. There's a lot of different things that a baby can be born with. So you must be 2 carriers of an abnormal gene to get sickle cell disease or another hemoglobinopathy.
Next question is, how long does the sickle cell trait last by generation? I have the trait, my boys don't, but when I married, I had to be sure my husband did not have it. My boys are good, but they have kids now.
Okay, same thing. The same thing. Sickle cell trait is genetic, it's passed through generation. It doesn't skip generations and you go, oh, well, I have it, my kids don't, and then the grandkids gonna have it. If you have the trait, you're born with the trait. If you have a hemoglobinopathy, you're born with the hemoglobinopathy. So it doesn't go away and it doesn't magically reappear. So if you have the trait and your mate does not have the trait, that's that 1 in 4 chance the child will have the trait. So if she's saying that she has the trait, her husband didn't have the trait, and the boys don't have the trait, so you can't pass on something that you don't have. So if her sons don't have the trait, they cannot pass the trait on to anybody else.
Right.
Now, if her grandkids, if her sons marry or get with someone and have another child and they may have the trait, then there's a possibility they may have a child with the trait. But since her sons don't have the trait, they can't pass on the trait because they don't have it.
Mm-hmm.
Okay. There's another question. It says, for Dr. Sherman, can you further explain the stigmas, especially from a physician's point of view?
I've heard called a lot of stuff, but never Dr. Sherman.
No, it's Dr. Strunk.
That's why I wasn't sure who that was.
Yeah, that's. I'm presuming that's me. That's Dr. Strunk. But
okay.
I will say that that I hear it from my patients quite a bit. Primarily, the stigmas in the emergency room, on the floors, especially when it comes to pain medicine. But I really think that we should hear this in the first person from our warriors, because I'm sure they have completely different perspectives on it than I would as a physician. I mean, I've seen it, I've heard about it from my patients, but I really think that, to get a better grasp is to ask our warriors what some of their experiences have been.
Okay.
Clifton.
I can take. I was gonna say I can take this. Um,
Go for it.
it's crazy. We've been, as warriors, have been called drug seekers, liars. I mean, you name it. The thing about this illness, right, is that there's no physical act of people can see, right? And so because of that, people tend to think about what you need. And so when you get to the ER, my most irritating scenario was I was having a crisis, I believe last year, and went to ER. Now, mind you, we as sickle cell patients already know what to do to alleviate ourselves of having to go to the hospital because we know of these thoughts that people tend to have. And so by the time that we end up in ER, this is what how you come there. I'm coming here because I've done all that I could do at home to try to eradicate the pain that I'm in. I've taken a hot shower. I've taken, my meds. I've tried to go to sleep. I've tried to sleep off. None of that worked. And so, long story short, I was in ER. I immediately was like, "Hey, I need something to ease this pain because if I'm gonna be sitting in ER for 3-4 hours, I need some help, right?" And they ended up giving me some pain meds. It was like 5 milligrams. And the irritating part of also going to the ER is being asked the question to rate your pain as a sickle cell patient between a scale through 0 and 10, or for some 0 to 100. And it's like, I'm surpassed any of those numbers because I'm in your face. And so there was a point that I got the medicine. It was 5 milliliters, which immediately took that pain away. But in my experience, if I'm at 1,000, whatever you've given me at the lowest dose or whichever dose, it's not going to last as long if I were not in pain. And so I ended up falling asleep waiting in the ER. And then that example that I use of being hit by a grown 34-year-old man at the time in years because I can't take the level of severity of pain. And so I went back to the nurses asking for more meds. They looked at me and was like, "Well, we've already given you 5 milligrams of Dilaudid, and normally we don't give narcotics in ER." And it's like, I'm not here to argue, fuss, or fight. I'm here because I need this, and I need you to get to whomever the powers may be to understand that 5 milligrams that you gave me, or 5 milliliters that you have given me, I think else. And so we live with combating about, do I go to ER and deal with this, knowing that I may run into someone who doesn't believe the fact I'm in as much pain as I'm in. I have friends who have experiences where straight up the pharmacist, straight up the physician has told them, "Well, I'm not going to write you that," and they're in the hospital, or to the degree that the nurses, "Oh, you're not in that. Are you judging me by how I look? Because we're tough." And 9 times out of 10, you're not going to be able to tell how much pain I'm in. And if I'm sitting there crying or moaning and complaining, understand that the level is surpassed anything of your comprehension. So give me what I need. Thank you, please. And let's move on. But it is a challenge.
I do have another question. How often do you have a crisis, and how long does the crisis last? Anyone of
That's hard to say because I put it to you this way, and some of us know Dr. Sherney, and how she explains it is that we're all snowflakes. And because we're all snowflakes, even though we're all snowflakes, right? We all have it. Each snowflake is different. And so I can have a crisis that lasts for a day. Someone else may have a crisis that lasts, you know, longer than that. Or I can have a crisis that starts in my back and then moves. Someone else may have a crisis that starts in their leg and it stays there. So to answer that question, there is no timing. You know what I mean? At least I don't know anyone to calculate like, hey, this is the standard. But to the point in which there may be fevers involved is the alarm to get your butt to the hospital. If you're under that, I believe it's 101. Lashardé, let me know if I'm right. But there's a threshold of fever, right? And once your temp gets.
Did we lose him?
I think his signal, but yes,
Right,
to piggyback, is he there?
I'm back. I don't know why I keep getting kicked off.
Oh.
But go ahead.
Oh, I was just gonna say, yes, the temperature of 101, we typically suggest that they head to the hospital because there could be some type of infection that they, you know, really need to seek medical attention for. So he was correct about that.
There's another question. It says, are hospital personnel trained on the pain that sickle cell warriors experience? And before anybody answered, I like to answer this. I'm a nurse. I'm a nurse educator now, but when I was in the hospital, we were taught. When I was in school, we was taught about sickle cell. I also did take care of a young lady that had sickle cell that was visiting a University of Toledo student. And so when I was trained, yes, I was educated, but it's not a big thing that's educated now in even in our literature that we're using to teach nursing students. It's not a whole lot because I know about it and I know what it deals with. I can add it to my curriculum when I teach, but I don't think personally that it's really covered with all personnel in the hospital setting.
Yeah.
And
No,
they're not doing a really good job with that.
no, not at all. And I know for a fact, Dr. Strunk and I have worked collectively to make sure that interns, medical interns, I know that he does his rounds and things like that. We try to make sure that we incorporate that within his scope of practice and doing those type of education pieces. That's part of my job to make sure that I'm out here educating medical staff, professionals, and things like that as part of the grant to make sure that we do not have those types of, that lack of information. But more importantly, not to cut you off, Dr. Strong, I was just going to, more importantly, I feel like this is where a lot of implicit bias trainings come into play, because everybody has unconscious and conscious biases, whether they believe that or not. So I think a lot of that is needed primarily in the ER, but then also on the hematology and oncology floor.
Yeah. What I can tell you, and I've asked our medical students this every time a new student comes through, how much time do you actually spend on sickle cell disease? What do you know? And they're lucky if they get a 1 hour lecture on it during their entire 4 years of medical training in medical school. The nursing staff, again, if I didn't make a conscious effort to proactively address this on a literally almost a daily basis, it's been it would be really challenging. And the med students are flabbergasted at the changes and the potential implications, complications of this disease. And they just had no idea before they walked through the door. So we need to really do a better job of educating all medical people. And I'm not just talking doctors, I'm talking about nurses, aides, staff, everyone who has patient contact for all the reasons that Lashade talked about, and for all the reasons of this is the most common genetic disease there is. And people don't walk around like they don't have a clue about it. So they know more about CF and hemophilia than they do about this. So anyways, I'll be quiet.
Well, I would definitely.
Because like Annie says, I
in.
talk too much.
Yeah, he does. I definitely like to jump in. So, from my point of view, since I don't work at the hospital and, I don't have to bite my tongue, so I can say what I want to say. But, everybody's talking about health disparities, but, in our world it's racism, because if sickle cell disease did not primarily affect folks with different colored skin, it will get more attention and and it's not a sexy disease. You're not going to make a lot of money. And the dichotomy of a person living with sickle cell disease is very difficult, as Clifton stated. You got all these snowflakes, and every snowflake is different. So there's no cookie cutter. So if I have congestive heart failure, well, I know that starts with this, and I know that can morph into this. If I have asthma, I know that can help with this. But a person with sickle cell disease, because it is genetic, every treatment is different. But in our healthcare industry, in that big cog, that big wheel of healthcare, we try to treat everybody the same. There's no individualized treatment. You don't come in. And when Clifton was talking about coming in and they're giving him the Lord, they don't titrate folks. They come in, they start you off with 0. They don't look in your medical chart to see that you're at a level 100. They give you 0. 0 is not going to do anything for me, but they want you to wait in the waiting room. If Clifton was that little cute little baby with the little curly hair, because doctors don't like to see babies cry, they get everything they want. These same lovely little babies grew up to be grown men and grown women. And when you have a grown man and a grown woman walking in saying they need Dilaudid, I need this much, I need it this how, they look differently and they become a threat. They're not cute anymore. And so this whole healthcare, this whole disparity, this whole system of barriers of health, is key word for racism, because we don't know how to treat people that we have no empathy or sympathy, because we just really don't care, because it's not affecting us. Until we see folk that look like us and talk like us, and maybe my child could get it. Maybe let me look at this a little differently. And I'm not saying, because see, Dr. Shrunk, I don't put him in that case. That's little C. I'm good with him. He knows how I am. So, and we get along. So
well,
he
thank
understands
you, I appreciate
exactly
that.
what I'm saying, because
No,
it
I
is so
agree.
true. And
I
when
agree.
we skirt around these issues about stigmas, it goes beyond bias. It goes beyond that, because I didn't ask you to become a doctor. I didn't ask you to get into the medical field. That's something you wanted to do. So I expect you to do your job. So if you were a garbage man, I expect you to pick up my trash. If you were a cook, I expect you to cook my food. If you're a physician, I expect you to care for me. But because people, they get, they just like, whatever. It's too hard. I don't want to do it. It's hard. It's hard caring for people when nobody's the same. And that's what we have here. And nobody wants to take the time. You have a handful of great hematologists, a handful of great ISTs, but general medicine, they don't understand the dichotomy of a sickle cell patient, and they don't want to learn the dichotomy. They want to go in, prescribe some medicine, how you do, rub your head, pat your feet, take your vitals, and walk out the room. So that's it in a nutshell.
The crazy thing about that, Miss Annie, when you say that, is so true, because it is completely different if it wasn't blatant. We are in the same rooms, same clinics as oncology patients, cancer patients, on the same floors. We see the royal treatment that they receive in comparison to us. And as I always say, I never take it, try to make their illness seem worse than ours or vice versa. But the reality is we share the same doctors. And that's the biggest thing coming from peds, where you have a specialist who's a pediatric hematologist that focuses on sickle cell, and then you get kicked or transferred. I like to say kicked, transferred to the adult side, and then you're stuck and put in with the rest of everybody who, you know, half, and I ain't gonna say half because we don't know. A lot of these doctors take you on because they have to, not because that's a passion of theirs.
Yep, and that kind of segue into what just a little bit what Annie asked. She asked about how have treatments improved over time to help people with sickle cell survive longer. So before we answer that, because we're gonna say we know that patients were not living long, but so that's why there's a shortage on hematologists, because most of them were doing pediatric. They weren't living past 14, you know, in the 50s or whatever. So now with the advances with medicine and these different therapies, we have patients living well off into their 60s. And, you know, so Annie, you can kind of talk about that, like the one patient.
Well, I mean, the thing is that that's true and it's not true. There were patients or people living with sickle cell longer. Last week we just buried Mr. Bates. He was 60 years old. His sister, they were twins. His sister died at 3. He lived to be 60. And then he lost his older brother died of sickle cell. So this mom who's still living has buried 3 children in different spans of their life. One at 3, one in their 30s, and one at 60. So people, it depends on who they get to care for them. I mean, and then the severity again. Carl and Carla were twins. Carla died at 3, where Carl lived to be 60. So it's the severity of the disease, and it's what they know at the time. So, but then we have some people. There's a lady in Ohio. She's 89. She's from Jamaica. She has sickle cell. She eats differently. She dances. She's on the drums corps. So people are living. It's just that what are they doing? And then I dare to say, because I've lost many family members with sickle cell, but I have a lot still living. Those that are living well were not on a lot of the drugs that they experimented with. Hydroxyurea was not the first. They had Droxurea. They were doing other kind of medications on giving or trying. When the doctor walks in and say, "You want to try this?" It's a trial. So experimenting with, and some people just chose, no, I'm just going to do penicillin. I'm going to take this. I'm going to take my vitamins. I'm going to do this. I'm not going to do this. And I'm going to drink my water. And I'm going to take all my vitamins. And I'm going to do what I have to do. And I'm going to exercise and eat right and take my penicillin. And those folk kind of fared a little better because their diet, and they weren't ingesting or imbibing a lot of things that they didn't know about. So we have that older group, but what we found is, since I've been in Ohio, I have actually buried people between 21 and 40, more so than folk over 40 and folk under 21, because of hydroxyurea and introducing that early. But that has been the age, and it has nothing to do with medication. It has something to do with the continuity and the cutoff of care that they were receiving on the pediatric level with that comprehensive wraparound services. And then when they were cut, as Clifton says, pushed over into the adult world, where everybody doesn't come in and coo and caw and say, "Oh, let me bring the specialist in, let me bring the hematologist in, let me bring the oncologist in, and let's bring let's look and see if you have any strokes, let's do the scans." And everybody walks around you and bring the services to you. When you're in 18, you got to go find services. You just don't find the services. You just don't go. And
Yep.
so between that age, they're falling off and falling, and then those are commonly are in the ER, and the ER becomes their primary care because they don't have that adult that can say, I will provide those services for you. So I don't care if I have the greatest medicine or am I in the best health, but if I don't have anybody to walk alongside of me in the medical field and provide that ongoing treatment, because the sickle cell is not going away on its own. It's not going anywhere. So, and if I don't have that service, because once I pass that, I get other things that I have to take care of. I have regular stuff. I got regular issues. I got high blood pressure. I got pre-diabetes. It doesn't stop me from getting those other things. I have, I have people that have cancer and sickle cell. They get way better treatment on the cancer side than they do on the sickle cell side. So, they can get their drugs, liver them, and have a little flashing thing and woo-woo-hee. They get gas card, food cards, they get a luxury hotel, they get it all. Thank God they got, they get something. So that's kind of where we are. And so it's that medicine is good if you can get it, because now you can't even afford it. It's too high to even get. So there's no use of making medicine. You can't afford to take it. So we got a whole lot of issues going on. So it's a lot of different things, but it comes from not having adult comprehensive centers to carry alongside the pediatric comprehensive centers and providing that education and finding someone to champion the cause to say, hey, these are the same people we took care of when they were, look at the picture. Hey, Ray. And you come and you say, hey, Dr. Shrunk. And they're like, no, back up.
I hope I don't say that, but yeah.
I'm not you, but the people over at the other hospital in Toledo.
Well, yeah.
So there's a question that said, so basically add to this, Annie. So they say, why doesn't the services carry over into adulthood?
Dr. Shrunk said it. Clifton said it. You know it. And our other sickle cell warrior on here knows that there are not enough folk. I mean, sickle cell is that's not sexy. Oh, it's not cutting edge. Ooh, I want to make $1 million to the race to the cure.
It ain't making no money.
Nobody's making any money. You don't make
money.
money. And so you can sit in the lab, you can find a cure for the cold. Yeah, and it's about money. I mean, at the end of the day, you can build insurance and you can do this and you can do that and you can do that. But that ain't the way I want to live. I want to be that cutting edge person in that lab. I want to, make that money.
And I use this example, Annie. So I was in a meeting talking about, how do we move the adult center forward as far as, comprehensive care, that sort of thing, sort of wraparound services, inpatient, outpatient. And I said, what I bill in my clinic does not even cover my salary. What covers my salary is, as an oncologist, is the chemotherapy, the scans, the labs, pharmacy, blood, everything else. And so, when you think about caring for sickle cell disease people with sickle cell, especially our pediatric patients, they're not generating a whole lot of revenue either. And frankly, it's having that kind of built-in model into the sickle cells, into the oncology part of it, that allows us to have that sort of wraparound service. The issue is when they become adults, people just don't care. They have they'd rather make money in their oncology center than necessarily, deal with or take care of adults with sickle cell who have a lot of other issues going on. So sorry, our phone's ringing.
I want to speak on the fact that Miss Annie had brought up the wraparound services, especially when they become adults, and Dr. Shrunk, you can attest to this. The fact that they are not told that cardiologists need to be a part of the wraparound services, because what's not being told that when they are going through that intensive pain and that intensive body shaping and unnormalcy, the heart takes a lot of pressure on that, which starts that heart disease. And if it's starting in the infant age, by the time you become an adult, your heart is tired. And so that's not being say, I want that to be said as well. You have to have, as an adult, they don't think you need that cardiologist coming from a pediatrician on too, but you need that wraparound as well.
There's a whole lot of services on the adult side that you
Absolutely
don't realize that you don't need on a ped side. So nephrology, pulmonology, cardiology,
Absolutely.
all those things, and remember, it's not just those specialty services. It's you're getting older, as Annie said. You've got to worry about your pre-diabetes. You got to worry about your colon screening. You got to worry
So
about your
that
prostate
therapy
screening,
piece,
everything,
you know? Yes.
all of it. So you're an adult too. So welcome to adulthood. So
It takes the body through a lot.
Yeah.
Body through a lot.
Absolutely.
And that's as a warrior and an advocate, that's why I am so in these spaces, because it goes beyond just, as Miss Annie said, there's so many layers to this, right? And it goes beyond just us talking about it. It goes to lobbyists and bills and who we elect and all of that to get those services approved. I know here in the state of Michigan, I'm part of this group that is working with the healthcare plans, the Medicaid healthcare plans, to share our side of the story as to why, as we talk about these wraparound services, are needed. And so as well, at least here in Michigan, the children can apply and they're able to get state aid. When you turn 18, are you aware of that? Are you aware of you may need these services? And so a lot of it, because we don't know who we're talking to out there, a lot of this comes from the parents, right? And making sure that in the midst of you making appointments, that you share with your child or whomever you're caring for, that, hey, at some point in time, these are the things you're going to have to do yourself. These are the things that you're going to have to stand up for, and don't allow someone to tell you otherwise. For myself, I knew I had a doctor. We had a switch. One doctor left and someone took over. And I had to convince him as to the reason why I needed all of these services. You're an oncologist, which further let me know you care nothing about the hematology side of sickle cell, because you wouldn't be asking me, why do I need an EKG? No. Everything I've been getting for the past 20 something years, we need to continue. Because if there's any opportunity to see something coming down the line, I need it to be checked out before it's this happened because he didn't get this test. And this happened because this was not known. And I am actually one of those patients who ended up with colon cancer last year at 34. So when we talk about life, I can deal with sickle cell. Telling me I had cancer is a whole nother conglomerate. I don't know what does that mean?
Right.
Telling somebody, they've got iron overload or liver problems, or telling somebody they've got all these other issues, is like, my whole life I fought this. I don't know how to deal with the rest of this stuff. So it takes these conversations to continue, but to also not just let them have a circular motion of getting us nowhere.
I know one thing that we're working on is ER. We've been working on ER protocol forever. So, pre-COVID, the ER protocol was they go to the ER, and when they do anything wrong, and they'd be like, we're going to call Miss Annie, and they would run and hide. So that was the ER protocol. But we have to work on having some standards. There's standards in there. It's just that, and I'm gonna just say this, Dr. Shrunk. No, I'm not just saying this because he's a good doctor. But you have some doctors who, those are their rules. I'm the doctor now, and I'm gonna tell you what you need, like that Messiah complex. No, you're not, because you don't own this space. I don't own the space. I don't have sickle cell. The only person that owns that space is you. That's your space. Now I can walk alongside of you, but you have to own that space. And if I'm telling you, and I'm glad that you're saying that, if I'm telling you that I want to continue the services I have, you're not going to come in here and whittle me down from an hour visit to 10 seconds and still expect to get the same money and not provide the services I need. And that's advocacy, because again, we have to teach our youth to advocate for themselves. I mean, that same example I used about Carla and Carla, the stickler is that the mom has taken care of all her children from cradle to grave. There's no reason why she was still taking care of her son at 60, because there was no adult that could understand and advocate for him the way she could, because she didn't trust other adults, because she's already lost 2 kids. So I'm going to do this. I'm going to hold on and do this. But he knew that his mom was going to be his advocate. But at what point were you going to be your advocate? So at 60, he was still living with his mom. And she's 80-some years old.
Yep.
So that's kind of the problem of educating young so they can understand. Again, unless you're going to get some miracle cure, this is your burden to carry. And the only person that can really carry and advocate for that is you. Because at some point, the hospital says you're 18. You can tell me to leave the room, and I got to leave the room.
Yep.
And you're going to have to advocate. You want to go to college. I can't go to college with you. You want to get married. I can't get married with you. I can't go, you want to do all these things. I can't do them with you. So you're going to have to educate.
I feel, and to piggyback off what you're saying, being a mother of 2 sickle cell warriors myself, I think at one point I wanted to keep them in a bubble. I wanted to protect them, but I was causing a hindrance by not allowing them to do certain things. So, being in my position, I've been able to, of course, this Annie, move up out of that and use the empowerment theory, not only with my clients, but with my children. So I think sometimes parents, they don't know how to move to that side of things, especially if you're not educated, or you're not a person that do research and all these things, you don't know what questions to ask or where to start. But if anybody is listening to this, that is a parent of young warriors, you have to empower them at a young age and let them know what they are able to do, because the world is already going to tell them what they can't do. You just have to show them what they're able to do and speak life into them. I believe in affirmation, positive words of affirmation, and what you put out there on your tongue and you manifest, that pulls through. So I'm always speaking highly into my children and telling them what they're able to do. As we see, we have 2 warriors on this call right now that are college graduates 2 times. So, they've been told that they can't go to school, or, all these things. There's going to be challenges, of course. I mean, that's just, even if you didn't have sickle cell, you're going to experience challenges in your life, but it's how you prevail. And that you have to take moderation. It's just doing things in moderation. Would you say that's the case, Chelsea and Clifton?
Absolutely. And I believe again, I can only speak from my standpoint and my parents. My parents raised me just how Miss Annie said and how you said. I'm not going to be here all the time. And so when you turn 18 and you want to go out to college, you need to know. But I think a lot of the, what should I call it, helicopter parenting comes from the guilt part of being the parent and thinking that I have to do it all. And at a certain point, from the time we're infants, of course. But I would tell any parent, by the time that child is in middle school, which really means in elementary school, they need to start knowing what medicines they're on. They need to start knowing what amount it is, what works for them, what doesn't. What if they're on a field trip? What if they're in school? And you're not there. I was young and could tell you what size needle I number one, because you're not going to stick me and mess my veins up, because I only got 1 or 2 pokes in me And if you mess it up with a needle that's too big, we done for, and so you got to train them. I don't like that word, but you got to teach them so that they know early on. And that's where we see a lot of, I worked at the hotel checking in people and kids 18, 19, 20, calling their parents, asking them simple questions like, who's my doctor? Where is, like just simple stuff that we as sickle cell warriors already know. My doctor, my hematologist is. I know what, and they should know what type of sickle cell that they have. Pertinent questions that come up in ER. In case you're not with them, they need to know, and that what that does is it allows them to feel as normal as possible, because guess what? Now I can go travel because my mom's not so worried about whether or not, if I get sick, am I going to be able to handle it? Or my dad or whomever is the caregiver, So when you say empowering, it's not just words of affirmation. It's, hey, teach them so that they can grow. None of us, say that for all of us, none of us want the sympathy. This is not a, you can keep your sympathy. I mean, have empathy, but sympathy, keep that. You know what I'm saying? We want to be able to do things on our own by ourselves. And 9 out of 10 times, if we could, we would. So if I'm calling on you, there's a reason as to why.
So Chelsea,
Let me shut up.
No, you fine. I want to bring my mentee in. Like I said, I'm trying to get her to speak out more about her diagnosis. So be that you are an older sibling and all of your siblings have sickle cell. Can you kind of like speak on that empowerment there, or like how you've been able to teach them?
Yeah, so I like most of my siblings don't have sickle cell. Like it skipped generations, and then also I have a sister that just found out she has the trait, and then I have a sister that has SC, and then I have a twin brother that has SC. And so in dealing with that, they've seen my experiences growing up. And I haven't been around like majority of my dad's side of the family, which that's the most family that has the sickle cell trait. But I have a sister that's just like me, in and out of the hospital most of the time when I was younger. And I've been able to empower her by just letting her know the things that I have learned. Growing up in a rural town, like we didn't have a lot of information. My grandma was my sole provider. My mom had me at a young age. And so my mom didn't really know much about sickle cell. And so my grandma always went to the hospital with me. We didn't have a hospital or like a primary care really in my hometown. So we had to travel to Kalamazoo. And my grandma knew all of this information, and she just passed it on to my mom to really understand like what was going on and the gist of it. But as far as me advocating and talking to my family, like they see me on social media talking about this, and I'm able to really talk to them more about certain things when it, like my sister know that she can call me when she's going through a crisis or episode. And I'm able to talk to my family about it, and they've seen my experiences. And so they're like asking me things, and I tell them, and if I don't know anything, I research and I look up things, because that's just what I've been doing, throughout my college journey. I've been trying to figure out, like I've been doing papers and stuff and doing more research on it myself, so that way I can pass it down to my family members and let them know that, just to advocate for themselves as well. But I feel like it's just been a thing where it just came innate, and it comes from experience. Like my sister, my stepmom and my mom got together, and they just had conversations about, the things that I was going through. And then I was able to help my sister. As far as my twin younger brother, we still, trying to let him know that he's not different from the other kids. He's the same. He can do whatever that he put his mind to. It's just that he has to be, careful with the things that he's doing. He's still young and growing and really smart, and he understands the things like, oh, I'm sick, I'm in the hospital. He understands like the meaning of that stuff, but he's still figuring it out and trying, and we're trying to like make sure that we educate him in a way to where he will understand that you can't be in the water for an hour or 2 hours. Like you're not different from the other kids, but you just have something that you can't really get rid of, and you have to like be careful. So I feel like that information has really helped me throughout life, and then also I feel like it's helping them as well.
I couldn't find a mute. Sorry. Thank you for sharing that. Denise, did you have any other questions for our panel or Ms.
I
Linda?
don't, no, there was one question in here that I think was spoke on before. I guess it was more of a statement that understanding, advocating for yourself is important, but those in the medical field needs to be responsible for providing some point in providing, taking responsibility for providing the care. And I think that was spoken on quite a bit, that we need to educate the medical field, people in the medical field. And then there was one question, and I don't know if it was brought up before. It was asked, is there a cure for sickle cell? I think that's our last question.
There's no universal cure, meaning everyone can't get it. So there is my niece and my goddaughter, both had bone marrow transplantation early on. So she was like the second person in Columbus to get it, and then the other one, it was like, oh, it was a fluke because the sister of my niece matched both of them, so it was kind of great because she had to get bone marrow twice, which was awesome. But there's no universal cure. Now Dr. Shrunk is going to come on and he's going to talk about gene therapy and all of that. Well, we're people of color, and there's certain things that we're not going to do. And I know that, like Clifton just said, they had this thing about, we're gonna just inject you with some HIV, and then because we know how to treat HIV, and then we're gonna give you this, and then you would have HIV, and they were like all upset because the sickle cell warriors was like, no, because see, sickle cell, I don't know HIV. So what if you inject me with HIV and I die, or it doesn't work and then I got HIV? I know a sickle cell. I don't know HIV. So there's a lot of different things coming down the line, but I can tell you that, I've had people that I've worked with, and when bone marrow transplantation came out, and you have people that do not qualify, he just made himself qualify. And here's a 23-year-old man who was struggling with sickle cell, and he was just in pain all the time, and he just didn't want to do it anymore. And so against everybody was like, no, don't do it. You've had too many strokes. You're going to have some organ damage coming on. He was just like, well, I just want to do it. I want to do it. So they did it. And he has the mental capacity of a 5-year-old. He was in a coma. He had some strokes. He almost died like 4 times. They teach him how to walk, teach him how to talk. So he went from a 23-year-old who's having episodes and having pain. Now he's a mental 5-year-old who's going to have to be taken care of the rest of his life. So people talk about these things, but you have to be mentally prepared, because for every person that they show you the good side of it, there's 100 folk. There's people that die. There's people that are worse off, and there are people that it doesn't work. And you may have 2 people that it works, and the rest of the people are worse. I mean, you never hear about those people. And that has always been my concern with clinical trials and experimental medications, because you never hear the stories of the people that it doesn't work. You only hear the story, oh, look at this lady, she can play tennis now. Where the other 100 people that was on the clinical trial? What happened to those 100 people? So now Dr. Trump's gonna come on, he's gonna tell you about all the good stuff that's coming down the line. But I'm gonna tell you, Black folk, Black folk, Hispanic folk, Asian folk, Mediterranean folk, Sub-Saharan African folk, you're not gonna play God on me. You're not gonna take my genes and redo them, and put them back in my body. That's something we're not gonna do. That's why we don't participate.
Yeah,
But that,
sorry, Clifton. Go ahead.
no, I was just gonna say that is absolutely true. I remember as a kid, when the whole bone marrow transplant came out, and before I could mentally even understand the concept, I was like, no, I'm good. I had two friends over the course of, one was when I was grown. My first one was when I was in like 10th grade. And they both passed. Albert passed first. And we went to elementary school together. And he came from when we talk about that whole genetics thing, I think it was a family, it was like 5 kids. 2 of the kids had the disease. And so when he passed away, it just was like, my mind was blown. Like, he got this whole to cure him, yet supposed to cure him, he's not dead, versus I'm gonna take this, live with it, run the race until the time is up. And there are so many stories that people don't talk about. I've got a friend who had a transplant and she is now infertile because of that. And so when we talk about cures and all of this, I was listening in on a panel yesterday. The biggest thing that we don't talk about, and again, I'm 35, so some things have changed and progressed. This whole going to mental therapy is relatively new in our communities. And so I would say for anyone, it is not too early to start with mental health therapy, because many of us rush life because we're on a race against the clock. When I got to high school, it was, okay, am I gonna make it to 12th grade? Then it was, am I gonna make it past college? Then I got married and had a kid and got divorced. So it was like, maybe I shouldn't have done that. But my whole life has been in a fast pace, let me accomplish this, because I don't know when my time, that seems to be, according to the medical professionals, is going to dwindle quicker than someone else's. And so I know that wasn't on there, but it is highly important for parents to understand that and to know that, hey, mental health is real. And if anybody has legitimate, like we talk about, like we see all the time, people talk about PTSD, and now we know what it is. And we learned it from those who are warriors, who are veterans. We live with this on a daily. I can remember being a kid, running in the basement, crying, because it's like, okay, how long do I really have? Am I always going to be in pain? Am I always going to live this life? Will I ever be considered normal? And the crazy part about it is, when I say it's all in your family and your parents and how much they push you, I know that there are some families who don't talk about this because it's taboo. I got a friend who you will never know he has sickle cell. And it's like, make us, but it is who we are. And you should never make a child feel less than because they have this. I'm gonna shut up because I can keep going for days. But there was just those tidbits that I wanted to leave parents with, like, just as it's your job to teach them right and wrong, it's your job to let them know that they have this illness, but this illness doesn't have them. I'm done.
I'm glad you brought that up, Clifton, because my question then was, I heard both of you say that you just learned to cope with it, was how do you do your self-care? And so I'm glad to hear that you actually, you do the therapy type of thing. The other thing I would like to ask you guys with, as being advocates and all out advocates about it is, have you guys thought about getting a pamphlet together, informational pamphlet together that will make things and get them out to the communities and our race to make it aware and make a big awareness about it. You guys have a plethora of information that parents, as you just stated, Clifton, that need to know. I think in that pamphlet, it should have the definitions of different physicians so they would know who to go to and who is needed as well. Because just because they have the doctorate in front of them, it does not mean that they know the titles and the actual actions that that doctor can perform. So I was just wondering if you guys would like to, wanted or thought about even getting together and getting at least a pamphlet together and or a small book with 5 pages, informational, that you guys can get together and get out there. At least put it in Mr. Strunk's office or something, or have more of these so that this awareness can get out, because word of mouth is the biggest advertisement that you can give to anybody. And so I think it's enough people on this Zoom that wouldn't mind being behind you on that.
So, Ms. Smith, there are pamphlets, not primarily speaking as far as what you were asking, as far as the doctors, like the different doctors. So that's something I would kind of look into, but I will also make sure there's not a toolkit already out. So I'm not double doing, I don't believe in reinventing the wheel. So that's something I will look into. But I know like in my clinic, I have a pamphlet primarily on blood donations, because here in Ohio, we do sickle cell Sabbath. And it's basically talk about minority blood donations and why that's important to get those types of blood to the Red Cross, because sickle cell patients, they require that, they lean on that.
Yeah,
So yeah, I'll look into that. More than likely, I'll probably put my mentor to work, Annie.
Come on now.
Because
My biggest thing is,
so I'll probably put her to work.
my biggest thing is, as it keeps
Go ahead, I'm sorry.
being said, the parents is the biggest ones that can advocate for their young lady or young man, right? And so once you actually give them some affirmations, some information on even how to word to the young lady or young man, you can make it as a children's book. I am just putting things out there. However, I think you should pick them up and run with them.
We do have a toolkit, so we'll get
LaSharday, could you also tell how your book became into fruition before Patty becomes
Yes. I don't know. Am I going in and out? Because some of the words sound like they're going. You told me to.
No,
I'm fine.
You're
Okay.
You're fine.
So let me be clear. I no longer sell that book. It is on Kindle, Amazon Kindle for free, but I no longer sell that book. I've moved on to bigger things. But basically, that book was to encourage my 4-year-old at the time. Now my oldest is 12. And he has 2 brothers who have sickle cell, who are 6 and 7. So it's basically just to give him, he was at the stage where he was learning how to read, and what better way to teach information through words. So my husband and I, we wrote this book to just give an introductory on what sickle cell is and how Emory was dealing with sickle cell. So they actually take that book to school every year with them to read to their class, so that their classmates are aware of what they have and why they are tired, why they need to lay on the cot, why they need extra snacks, water all the time, and frequent bathroom breaks. And because kids can be mean, especially when they're young and they're impressionable, they don't understand. And when you are dealing with things that are different from other students, you want to make sure that you are using it as a teachable moment. So that's basically what the book was to do, just inform, because at the time there wasn't a lot of literature out there for children, but now there's a huge library of amazing young Black authors who have just taken this a whole, there's comic books, there's all types of things. And my kids have them all. So just having that piece to be able to teach their fellow classmates why they're dealing with these things has just been the most easiest thing for me as a parent. And like I said, my kids are 6 and 7 that have sickle cell, and they advocate very well for themselves. So when we speak of that empowerment piece, I don't even have to go to the school and do my little presentations that I usually do, because they telling their teachers from the gate, like, look, I have sickle cell SS. I take, this medication and this amount, so they've learned very well. I'll say that.
That's awesome. I want to get it to others.
Just a reminder that in the chat, there is the link for you to do an evaluation of the program. And we ask that everybody would take time to do the evaluation. And at this time, we'll have Patty Poston, who's the president of the Mommy Bay Club, to come and give our closing remarks.
Good evening, everyone. Again, I'm Patty Poston, president of the Mommy Bay Club. And I would just like to say, wow, this is my second year participating in the sickle cell virtual program that we've collaborated on. And, I learn more and more every year. And I don't know if you notice, I'm a head shaker and I'm shaking my head. No, yes. It's like some of the things that I'm hearing, especially from our warriors, the adult warriors, that there's still so much work to be done. So as we close tonight, I would like to first of all thank LaSharday and Annie and Dr. Strunk, who are our experts on sickle cell. The things that they're doing in our communities have made a difference. And I would just like to encourage you all to continue the fight, to continue to do what you're doing, making headway in the hospitals, in the adult community seems to be a little worse off than the pediatrics. So I just want to encourage you all to continue to do what you're doing. And for Chelsea and Clifton, the stories are just magnificent. They are something that we need to hear, that we need to know people are going through. And your testimonies are a comfort to someone that will hear this will know that they can move to the next level. Advocating for themselves, that was important, that they know those things. If they have parents that are keeping them from knowing more, they will, take the rein and begin to learn more about their disease, how they're being treated, and can move forward in life, go to college, experience some of the things that you all have experienced. And I just cannot thank you enough for sharing with us tonight. And again, knowing what you're doing is making a difference. Also, I would like to thank the collaborative team, as Governor Denise announced the names earlier, who took part in this program of sharing the information on sickle cell disease. We would like to continue this relationship and getting the information out to our communities every September so that we can hear more success stories of young people who have conquered some of the milestones that this disease presents. Also like to take a moment to thank anyone here who was part of our voter registration program that we held earlier this month as a collaborative team, and it was a successful day. And if you're not registered to vote, please take the time to get registered. I know in Ohio, the deadline date is October the 11th. So please register. And if you think your precinct has moved, make sure that you check that out too. And be prepared to vote in the next election. Two upcoming programs that we'll have in the month of October is domestic violence and triple negative breast cancer and how it affects the African American woman. So watch for those programs. They'll be on any of our social media pages, and we'll get out emails to you as well. Again, thank you for participating tonight. Please complete the survey or the evaluation, And you all have an enjoyable rest of the evening. Good night.
Good night. Thank you.
Good night. Thanks for having me.
Thank you, LaSharde, and your special guests. Thank you, everyone, for all your work and support.
Phenomenal program. Thank you all for your participation, your expertise, and educating us tonight.
Don't close out yet. I need to get the evaluation form real quick. Okay, I'm all set. Good night.
Right.
Yeah, anybody else on still, please complete the evaluation so that we can have that data.
I opened it up, Lexi, so I have it on my internet browser so that I can
Okay.
close out.
Okay.
Okay,
This
good
was,
night, y'all.
and you know,
Thank
this
you,
was a
Lexi.
wonderful program, and my heart is
Oh, I
just
have a
so,
question for you.
yes.
Will the YWCA be participating in the domestic violence program coming up?
Okay, so let me talk about that. So what happened, we were, and is Denise still on?
Yes, uh-huh.
No. Yes, hi.
Denise
Okay,
is here.
so oh my gosh. So Denise, you know, we talked about having our person, you know, she won't contact me back. I
Is
have
that Rachel?
sent her stuff. No, Rachel is, you know, we have our program going for the Lunch and Learn webinar. We have
Right.
it. It's gun violence. It's called Gun Violence, the intersection between guns, domestic violence, and race. And so it's happening. What we were needing was, what we had was a club member who was going to also be a part of that so that we can, you know, put it under club. But I reached out to her. I don't know if she's not willing to, you know, she hasn't gotten back to me, Denise,
Is she a
and
speak? Would she be a speaker or something?
yeah, because I want a
Oh,
panel. So we have a
okay.
panel, you know, and so our racial justice, I'm the racial justice. Our DV director is the main speaker. And then, you know, a person from the Ohio Domestic Violence Network, you know, from Ohio, who will be providing, you know, the statistics and everything. She's on board. And so, you know, I wanted another person, at least one or two more people to be on that. And so what we were supposed to do was have her, because
I
she's
hate to
a club
interrupt you. Are you
member.
still recording this? You still
Yeah.
recording? This should not be
Okay.
on. Yeah.
Yeah, you should take that off. And then when you do the recording, you have to
We'll have to delete
snap
it.
that off the end. And so what I wanted to do, yeah, is to say stop recording.
It hasn't, it's still recording.
Dang. Yeah, if you go down to the bottom where it says recording, and then you can just click on that, and then where it says recording, and then click on it to stop recording.
Okay, it didn't stop on, you want me to just call you? It's still
You can't stop
recording.
because we really need to just stop the recording.
The little red button still blinking.
Oh, maybe. Let me see. All right, maybe I'll have to just end the meeting and then we
Okay,
can
and then
talk
I'll just
later.
give you a call. What's a good day? Tomorrow, or you want me to call you tonight?
And we're talking about the
Domestic violence?
domestic violence program. So tomorrow, actually maybe over the weekend, because I have our lunch and learn for tomorrow
Okay,
that I'm doing. And then we are working towards the next lunch and learn. And so how we can fit that in. And I need to find out also from the director of DVS is,
okay,
are they doing another program in person that we could help with? And so
okay.
that is
So,
something that I need to find out.
okay, so your department is doing a program
No,
and
no,
the
because I don't handle
YWCA,
domestic violence.
right? Rachel Garner, correct? Is she the one
Yeah,
that's the chairperson?
yes.
Okay,
Now, what we are doing, what my department is doing, the racial justice department is doing, we have lunch and learn webinars, and our lunch and learn focus on disparities in health and, in health
so
with
that could be
people of
like
color.
extra
Like this would have been
programming.
this right here would have been a perfect uh lunch and learn webinar. It really would have, because nobody, people don't know about this sickle cell, and
Right. It was
the disparities are really because it's a disease of people of color. I did kind of ask that question, it didn't get an answer, but I think nobody wanted to touch that. But it is truly a reason, because it's a Black person problem. It
I
doesn't
was gonna,
affect us, so we don't care.
I was
And
gonna
that's
tell you
why,
too, Lexi, I hate to interrupt you, on the domestic violence, breast cancer too, Denise Carr and the nurses are also trying to put together a little something, so whatever we decide, they can join in on us on that, or domestic violence.
that would be great. And I feel like this time around on the breast cancer, instead of always doing the same thing, we should switch it up.
Well, they're nurses, so these are all Denise Carr, Miss Sims, Victoria Sims, and a few other people, and then they had a few guest speakers that they were trying to pull in as well. So
That will be great. So we
okay,
can do something different than always having to ask Linda to do it every single year. And it's the same program,
right.
something different. But okay, and I think that what will happen, because this Zoom is on my Zoom and it records in the cloud, I'll be able to clip the end of this off.
Okay, good.
Yeah, but I
And
really
also,
I really want to have this out to other people, because this was such a really good program and such important information. And it really makes me so sad that this is how it is for us. And
right.
this kind of thing. It makes me so sad about that. And I don't know, last year, I think it might have been pointed out, but I lost a cousin. My mother's nephew, died at 24 from sickle cell. And I knew two people from high school, Paula and
Yeah,
Paul Bond, who
yeah,
died from sickle cell at a very young age. And that's why it's like, for people to still treat people this way,
right. And they still that way.
and they're
Yeah,
like they're more aware of their mortality
yes,
than any of us.
yeah,
And it just is really sad that it has to be this way, and then they still have to go to the hospital and deal with doctors who don't know anything about us. So yeah, that's really upsetting. And I'm sad that I named the doctor, but he didn't answer the question though, because I wanted to know from the standpoint of the doctors in the plate, like, how do they view,
He
or
did
do they
kind of
have a
answer it. He said they don't care.
Mm,
He said they don't care.
And they don't have the knowledge. He said they don't, that's not one of the things they study very often. He said it,
yeah,
he
he did
answered
say
it.
Because
that.
they don't care.
If it were,
They
if
don't
it
think
were a
it's important
situation
enough
where
because
their
it's not
kids or
money.
their family might have to face, they would figure it out. But because it's
Right.
us, and
There's
that's
no
really,
money involved in the research or the study of it. And there's no money involved. That's why they really don't even want to have a cure for some of the other ones, because there's money in the research and the fundraisers.
mhm, really sad. And
It's
and
sad.
and the people who are dealing with
I
this,
admire their advocacy and their courage of persistence. And
mhm,
when other people hear, they get in the fight too. It
Yeah.
has to be that way. We have to advocate along with them. I had 3 cousins, sisters that passed from sickle cell. The first one, the oldest girl, she was in her 20s. The middle girl, it's 3 of 5 sisters. They all were sisters, but 3 of them in the middle passed away. It was the oldest one in her 20s, the middle one, she was in her 30s, and the youngest one was in her, of the 3, was in her 30s. No, she ended up being 40. So because it's been like just a few years ago, she ended up living longer. And so this family was 3 girls out of 5 girls. This family, my cousins, we had to go through that. The mom, the dad, the cousins, the grandmas. It was hard.
You guys, who's
Yeah.
Marcia? Marcia, somebody's still on the line, Marcia.
Yeah, Marcia is a member of Mommy Bay.
Yeah.
Okay. Okay,
Hey,
did
guys.
she got any comments you want to make?
No, actually, I had no intellect when it comes to sickle cell, and I know a few people with it. So the suggestion to actually have a booklet that gives direction as far as the different physicians and locations and all that, that would be really, really helpful to a lot of people I know.
Yeah,
I
yeah.
think so too. And also just, how to advocate for yourself and all those things. And
Yeah.
especially, what really floored me was when they said how, as a young person, as a kid, you are telling, you have to become an adult as a kid having
Right.
this and telling people about this. And then
Right.
another thing that I wondered about is, even when people pass away, do they pass away from the disease itself or from the stress of having the disease?
It sounds
Right.
like the side effects of it, like the heart trouble and the
Right.
asthma
And
and
all
the
of
anemia.
that,
Yeah.
and just being exhausted and just being,
Mm-hmm.
and you're tired of going to the hospital, and then they prick you and prick you to death on
Mm-hmm.
things, and then never listen to you though about your pain,
And
Right.
then
and
I
never
did,
listen to you about your how you feel. I mean, because it's sad, because this is a little personal to me, because my first cousin, his name was Wayne, and he dealt with this all his life. And when we used to go and we were supposed to be playing, all us cousins, he would be really, really sick. And he
Oh,
would be just like in so much pain. And he'd always have to go to the hospital all the time. Never knew what that was about or anything. And then as he got older, he lived in, Long Beach, California, and he tried to live his life as a normal Black
right.
teen. like how they do and whatever he did. And, you know, he tried and he has
Yeah.
his son, but you know, it's like he succumbed because he was always in and out of the hospital with that
Right, yeah.
pain. He was
Yeah.
always in pain.
Yeah.
So that pain that they were talking about,
Right.
you
That's how my
know,
cousins were always in the hospital.
And we
I-
don't understand it. Yeah.
mhm.
I got a
Mhm.
question. On Monday night, are you guys available to me to talk about the domestic violence and the breast cancers? Because we got to start getting flyers out for that too.
Right. And I've already started working on it. Flyers.
Okay, okay. So would Monday night be a good time for us?
There is
Let me see. Look at my calendar.
Tara and we spoke up about the domestic violence program, and we've been going back and forth talking about it. That's why I was asking Alexi if the YWCA was doing anything that we can collaborate so that we can go in and get a date set.
See, that's
So
what I
Yeah,
was
you
gonna.
know what? And what I'll suggest to you
Okay.
is to go ahead and do your own program because I am
Well,
in
we can
trying
do
to
that one too
things.
later on
Well,
if you find out. the
Well, Lisa
information.
did say she want to be part of both of these programs for October.
Right. And then the
So
thing about it is though, my problem is, like I was telling you earlier, one of the things that I cannot do and I refuse to do, period, is chase somebody to chase people down.
Yeah.
Mhm.
I had to almost do that for the September lunch and learn. And I had to switch
when
the
we get
whole
together, maybe I'll have the answer Monday night about the other part I was telling you about, those nurses who might have something to put together.
Or the
They may
triple
have
the
something.
pink. Okay. Now
Yeah,
we're gonna
so
meet
yeah,
at
so we could do
9
that,
o'clock on
and that will
Zoom.
be another program. Another
that'll
part
be
of the program.
fine. Zoom will be good, Brenda.
Okay, I'll send out a link for
Okay.
9 o'clock. Good.
Yeah.
9 o'clock is okay if that's what you want. Yeah.
Today?
I'm looking out for you because you're usually working.
That day I'm off. That's what I'm saying.
Oh, okay. So Monday will be the 4th. Is that the 4th?
It's the 3rd.
The 3rd.
Okay, let me look at my
Okay.
calendar.
Then you want to
Monday
do
the
7 or
3rd.
8?
Yeah.
Which one's good for you, Lexi?
Monday the 3rd is totally and completely free. I can't even believe it. There's nothing on my
Okay.
calendar that day. So
Okay.
whatever you want,
Okay.
whatever
Brenda.
whatever
All right.
Up to you,
time
Brenda.
choose.
Okay, then
8
I need to, I think, I don't have my phone right with me, but let's say 7.
Yeah.
Okay, 7 o'clock.
And if,
Collaborate.
when I go to my phone, if it's something different, then,
Okay.
babe, bring my phone, please.
Monday the 7th.
I'm gonna find out.
Monday
right
the
now.
3rd.
The
Monday the
3rd.
3rd.
I mean
Yeah.
the 3rd at 7.
Right.
All
On the
right.
3rd at
Okay.
7.
And this one is to plan which one?
The domestic violence and
triple
the pink.
Yeah.
Okay. All right. Yeah. And I was, I was tasked already from
Thank you for that Blade article too.
Oh, yeah.
Well,
Oh,
thank
yeah.
you
And
for
I'm
all
really
that you're
disappointed.
doing.
I'm disappointed. You know what? News people really irk me. And I'm going to tell you why. Like they really
put
truly
what they
irk
want.
me.
Yeah.
Because they only post the little snippets or the angles that they want. And
Right.
one of those news, like the second news article from the Blade, gonna ask people, you voting Democratic or Republican? You know, what we did was nonpartisan. We are not allowed to.
Exactly.
And they really.
You guys, I got to get off the phone because I got my daughter over here.
Okay.
So Okay.
Okay.
I see
Yeah,
y'all
7
later.
o'clock is good.
Okay.
All right.
Thanks.
So
See
I'll
y'all
send
later.
out the link for you
See you
all,
later.
okay?
Bye-bye.
Okay, thank you for all
I'll
that
look
you do,
for it.
Lexi. Thanks.
Thank you.
All right, bye,
Bye-bye.
y'all.